So today we're going to talk about guidelines that parents can use to help their child manage chronic pain. First though, I want to talk a little bit about how you're helping to manage Will's migraine pain right now.
I keep him home from school when he says his pain is too bad. I give his rescue medication and keep a cold compress ready for when he needs it. I check in and ask how he's doing.
Yeah, you're clearly a caring, loving parent and you're doing a really good job. It's interesting though, the way that we think about chronic pain management is different from how we approach pain associated with, an acute injury or illness. And these differences are not obvious. They certainly weren't to me until I started to learn more about it. Let's go through some of those different recommendations now, and I encourage you to share them with any other grown-up who helps you take care of Will.
Okay.
Amazing. Okay, so first, this might seem like a change, but I suggest that you limit checking in with Will about his pain. If you ever had an injury where, maybe it wasn't bothering you too much, but then someone asked you about it and you were like, oh yeah, that does hurt. Yeah, that's why we want to limit status checks, because they can make the child more aware of their pain symptoms, causing the pain to seem worse.
It's gonna be tough.
I know, I get that, but it's not to say that you can't check in at all. Maybe we can drop back or limit the amount of checking.
I could do that, I suppose.
Okay, great. It's a really good opportunity for Will to practice tracking his own symptoms, especially using the symptom tracker that we talked about earlier. Plus, it's a good opportunity for him to practice for when he's older and needs to manage his own medical care. You could check in with him periodically, though, about how things are going. What would you think about checking in maybe once a week?
I think that could be doable.
Okay, when is a good time to check in?
I could check in on Sundays.
That's great. I think that would work fine. Another recommendation is to make sure that Will is attending school to the greatest extent possible. That means bringing him in on time every day and not picking him up early if he calls and says that he isn't feeling well. To make sure that he can be successful staying in school, we'll collaborate and come up with a plan for him to be able to, practice his coping skills and hydrate and take breaks throughout the school day. This will give both you and his teachers lots of opportunities to praise him for using coping skills.
I guess I could work on that, but sometimes he gets really sick when he has a migraine. He throws up and is just totally down and out. I don't see how I would get him to school on those days.
Yeah, I get that. You're right. Sometimes he is going to be too sick to go to school. When that happens, though, we need to make home as restful as possible. So we're going to treat migraine symptoms like you would any other illness so he can recover quickly and fully. What that really means is taking away screens and other fun activities. Basically, we don't want to offer special treatments. We want the focus to be on getting symptoms under control and getting back to school, not on how much more fun it is to be at home.
That makes sense.
Okay. Now, what questions do you have about his medications?
None. I think we're all good. He's been on the same thing for a while, and I just gave it to him like the doctor prescribed and seems to be okay.
Okay, great. If you ever find that the meds aren't working and you need or want to change things up, make sure to communicate that with your healthcare team, and there may be other options.
Can do.
Great. I know that these recommendations are a little tricky and sometimes not super intuitive, but I'm confident that you're going to be able to use them to help manage Will's pain.
Thank you.